Hi everyone, Dr. Luczka here from InstaCare Physical Therapy. Today, we're going to have 3 experts talk about how they help their clients with bone and joint health. First up is Diewald from Nutrition for a Living. She's a registered dietitian and she'll talk to us about how you can best utilize nutrition to help your bone and joint health. Second, myself will talk to you about how movement can help your bones and joints stay healthy. And finally, we'll have Marlena, the owner of Personalized Fitness for You, a certified personal trainer, talk about her favorite exercises for bone and joint health. Let's get started.
Hello, my name is Diewald, and I'm happy to be with you today. I'm a registered dietitian. I work at a private practice called Nutrition for a Living, located in Exton and Kennett Square. I'm going to be talking with you today about nutrients involved in bone health. We want to make sure that our bones are in good shape, especially as we get older and become more at risk for osteoporosis. Paying attention to diet and paying attention to other lifestyle factors is extremely important. So we're going to start by talking about vitamin D and calcium. And vitamin D and calcium have a nice little partnership going on. If you have enough calcium, but you don't have enough vitamin D, you're in trouble, and vice versa. So they go together. And so therefore we'll talk about them together. Vitamin D is particularly interesting. We call it a vitamin, but it's actually more like a hormone, meaning it stimulates the action of something in your body. And particularly what it does is it stimulates the absorption of calcium from your gastrointestinal tract and helps it eventually get to the bones where that calcium can give some rigidity and strength. So there's an example of the partnership. Vitamin D is also, we're finding more and more important in immunity and in depression and in other conditions such as type 2 diabetes, and even may play a role in cancer prevention and cardiovascular disease risk reduction. We get vitamin D from 2 main sources. We get it from the sun, and that's why it's called the sunshine vitamin. It's a good idea to make sure that you get 10 to 30 minutes of sunlight every day. If you have darker skin, you should aim towards the 30 minutes. If you have lighter skin, you may only need 10 or 15 minutes. It's very easy to do when it's in the middle of the spring or the summer when the days are long. It becomes more challenging though in the late fall and the winter when the days are shorter, but it's every bit as important to make sure you get your sunshine in during those months as well. When we talk about vitamin D in diet, there's really not a whole lot of naturally occurring vitamin D in foods. There's a little bit in salmon and in sardines and in egg yolks. But by and large, we depend on the fortification of products to give us the vitamin D that we need. So we're going to take a look at a few of them now, and we'll also bring in calcium as well. So the thing that we think about most often when we think about vitamin D, we think about milk, because milk has been fortified since the 1930s with vitamin D, because it was known to help reduce the risk of rickets, which is a terrible bone disease that children were experiencing back in the early part of the 1900s. And so milk is fortified with vitamin D. If you enjoy the taste of milk, a couple glasses of milk a day will give you vitamin D and calcium all at once. So that's great. Another option in the dairy mode for getting both calcium and vitamin D is to look towards something like kefir. Kefir is a fermented milk product, so it sort of tastes like plain yogurt in a liquid form. You need to check the label to make sure, but some brands are fortified with both calcium and vitamin D. So check the label. If you don't like it in its sort of tangy form, you can always add a little fruit or a little bit of honey, and that can help change up the taste a little bit. If you don't want to drink milk or don't drink milk, you can go ahead and use a non-dairy milk alternative, but you have to be really careful because vitamin D and calcium are not universally found in all non-dairy milk options. So check the labels on your almond milk and soy milk and rice milk and coconut milk. I happen to like this pea protein milk, which is called Ripple. It's got 8 grams of protein in it, so it's got protein, whereas some of the other non-dairy milks don't have that in it. And if you check the label, you can see that it has about 30% of the daily value for vitamin D, and it has more calcium in it than a glass of milk. So if you don't like milk or don't drink milk, there are lots of great non-dairy milk alternatives out there. You just have to be careful about reading the label. You look at other sources of vitamin D. There are some cereals that are fortified with vitamin D. Kellogg's has recently started fortifying their cereals. Not all of them, just a few at first. So Special K and Rice Krispies are now fortified with vitamin D. And if you team it up with a non-dairy milk alternative or with regular milk, you've got a meal that has a good chunk of vitamin D and calcium. Cheerios is another cereal that's fortified with vitamin D. So there are options out there. You just need to, again, check labels for vitamin D. When we switch off to calcium, we see that certainly there's some calcium in yogurt. Yogurt is an excellent source of calcium. You can also get some calcium in cottage cheese. Which also, or regular cheese, low-fat cheese, which also gives you a nice dose of calcium. There are also some non-milk alternatives for calcium. You can get calcium from cannellini beans. You can get calcium from almonds. You can get calcium from green leafy vegetables like spinach or kale or collard greens. So again, it's a matter of reading labels, getting an overall balanced diet with lots of different food groups, and just being intentional about working hard to get calcium and vitamin D. If you can't get vitamin D through food sources or calcium through food sources, you can resort to supplements. It's not the ideal way to get it, but you can get it that way. A regular over-the-counter vitamin supplement would contain some vitamin D in it. You don't need a excess. You can go with something like 100% of the daily value for vitamin D. And if you need calcium, you would probably need to resort to a separate calcium supplement for that. So be intentional, and you can certainly reduce your risk factors for bone conditions as you get older. Thanks for listening.
Dr. Dan Luczka here from InstaCare Physical Therapy to discuss how a doctor of physical therapy can help with your bone and joint health. I'm going to share a PowerPoint to help with this presentation. Let's see what a physical therapist can do for you. 2 common bone conditions that I treat here are osteoporosis or penia and osteoarthritis, aka bone-on-bone or degenerative joint disease. Often people ask me with osteoporosis, what can they do that's safe? Commonly, people are curious if exercising in general is safe to do, and the answer is yes. It is safe to exercise with osteoporosis. What you need to be aware of is that someone who knows what they're talking about is following your workout plan to make sure it's not too aggressive or too conservative, so you're not going to improve your bone health. Exercising can put a progressively increased load on your bones, and that progressively increasing load can help your bones adapt to get stronger. Lifting weights are safe with osteoporosis, again, but as long as someone who knows what they're talking about is following your plan to make sure that the weights aren't too heavy, causing excess pressure and damage to the bones, but also isn't too light, therefore not creating that increased demand that our bones need to get stronger. So the way that bones do get stronger is called Wolff's Law. Wolff's Law basically implies that our body adapts to the stresses and pressures we put on it. We know from a plethora of research articles that lifting weights is safe for our body with osteoporosis and to help prevent osteoporosis from occurring, as long as it's supervised by someone who knows what they're talking about with that population. If you have arthritis in your knees, lots of people ask me what they can do for that. And one of the best things that they can do is remember the saying, motion is lotion. Think of the Tin Man from the Wizard of Oz. Can't move well because he's very stiff in his joints, but once he puts a little grease or WD-40 in his joints, he's a lot more limber and able to move and accomplish what he wants to. Our joints don't get nutrition from blood supply like our muscles do. They get their nutrition from synovial joint fluid, which moves in and out of our joint with motion. So it's important not only to move to have our joints healthier, but to move frequently is the best thing for us. So if you are going to be a couch potato all day long, and then at the end of the day move for just 1 hour, that is not as beneficial as if you can move a little bit, but multiple times throughout the day. That's as far as our joint health goes. Another thing to be aware of for joint health, not only moving frequently, but to move through your full range of motion. So making sure that even though you're going to do some squats to improve your leg strength, at a certain point, it can be important to do squats a little bit deeper than you're used to, not with weight, but just through an active range of motion to make sure that joint is able to always go through this full range to make sure that joint capsule is as loose as it needs to be. Not that you need to regularly squat all the way down or do certain movements to their full end range in your daily life, but making sure that you check in every once in a while that your body can do that full range is important, so you don't fall somewhere and then have your joint go to that full range at that moment when it hasn't in the last 6 months. What's also important for joint health is adequate water intake. We need a lot of water to make sure our joints stay healthy and lubricated properly. So a lack of water, if we're dehydrated, can significantly impact our joints in a negative way. We want to make sure we avoid soda and refined sugars, which can have a negative impact on bone density. And it is nice to run if we can. As long as you have proper running form, shoe wear, and you're progressively increasing your running volume, it is safe to run. And research has found out that people who have a mild to moderate amount of running per week are actually better off with less arthritis than people that don't run at all. Now back to the motion is lotion. Remember that joints get the nutrition when they move through a full range of motion, and it's best to move often. Joint synovial fluid helps lubricate the joint and provides nutrition to the joint and clears waste out of the joint. So motion is lotion. You got to use it or lose it. If you don't use your full range of motion, you're going to lose your full range of motion. Knee osteoarthritis is a very common condition that we see here. Surgery doesn't have to be your only option for a meniscus tear. Getting physical therapy first can help 60 to 70% of people with knee osteoarthritis avoid surgery altogether. So make sure that you have a physical therapist that you know and trust that will listen to you and treat you one-on-one to make sure you get maximum results for that strong chance that you can avoid any surgery on your knee. Now, a lot of people will say, don't I need an MRI before seeing a physical therapist? Lots of times you do not. The prevalence of knee osteoarthritis that shows up in an MRI in asymptomatic uninjured adults is more common than you think. After a study reviewed 63 other studies, they found 5,400 knee MRIs were performed, and they looked at these knees in people who are pain-free individuals. The results, a little surprising. MRI osteoarthritis was present in 19 to 43% of the pain-free adults over the age of 40. So if we look at that number in the middle, we can call it about 30%. So about 30% of people over the age of 40 can have knee osteoarthritis on their MRI, yet they're pain-free. So just because you had imaging done and it says there's osteoarthritis there, don't think that now you can't run or be active or be pain-free. You absolutely can. And we're finding that having osteoarthritis on imaging is more likely part of a general track of aging than it is really an abnormality. So it really is common and expected that we get osteoarthritis as we age. It's more of a matter of, is that impacting you and causing pain or not? Sometimes it absolutely can, but sometimes it absolutely is not the causation of pain. It's just present on your imaging. So don't be fearful when you hear osteoarthritis on your imaging. What's more important is how you're presenting. How are your symptoms? What are you able to do or not do? So if you have knee pain, this is what we can do from the most conservative to risky interventions for you. On the most conservative, which would be your first step, is seeing a doctor of physical therapy. If you see the right one, you don't need a script or referral to even see them, saving you more time and money, but they should be able to diagnose you to see what's going on, figure out what you need to do and what you should avoid to feel your best. If that weren't to work, which it does a majority of the time, then the next most invasive intervention would be injections, using some sort of injection into your knee, whether cortisone, Synvisc, or various other ones, or other medications, whether they're anti-inflammatories, pain medications, etc. If that doesn't work, then the last option should be surgery. You should never jump to surgery without at least talking about those first two options with your primary care provider. Surgery could be anything from a meniscus scope to having a knee replacement, and that should definitely be considered as a last resort, as lots of times with surgery, you can still be left with some pain or may need to do some physical therapy afterwards anyways, so it's good to at least start with that to see if you can avoid it. If your provider is telling you just to take Advil and rest because of your pain, you should find another provider who can help focus on keeping you active and healthy, not just telling you to do bed rest. We know that seeing a physical therapist sooner than later can be beneficial for you. In a retrospective study of more than 30,000 patients, which was published in the Spine Journal, they looked at people who saw a physical therapist within 14 days of getting hurt versus people who saw a physical therapist after 14 days of getting hurt. And in the group that had early physical therapy interventions, saw a decreased need for multiple physician visits, a reduced use of advanced imaging or like an MRI or CT scan by 74%, a reduced need for surgery by 55%, and reduced costs overall by about $2,800 per person. So if you have pain, don't delay, don't wait weeks and months on end. Go see your physical therapist sooner than later. It can really help you in the long term, and your future self will thank you for it. So how can a doctor of physical therapy fix knee pain? Well, with our examination, after we get our diagnosis and figure out what's going on with you, we can give you targeted strengthening exercises that are specific to your body and specific to your phase of rehab. If you were just to Google knee pain exercises, you would find so many exercises you would be lost on what you should and shouldn't do for your body in your phase of rehab. The doctor of physical therapy can tell you exactly what those are for you. You want to ensure that you're doing some full range of motion for that joint, making sure you're going all the way extended and flexed, whether it's your elbow, your knee, your hips, but making sure you get that full range can really make sure that joint is appropriately loose and mobile, making it as healthy as possible. There are a lot of hands-on techniques that a physical therapist can do. When you have arthritis, the bones are closer together. You may have heard that bone-on-bone terminology used before. But what's happening is when we have arthritis, the bones being a little bit closer together, they're stiffer. The ligaments and the capsule holding those bones together doesn't move as well. So there's hands-on techniques that we can do to allow that joint to move better, therefore causing less pain. There's also a lot of hands-on techniques we can do to the muscles and fascia surrounding the joints, just allowing your body to have the best mechanics possible. So up and down your chain, you're feeling as pain-free and mobile as you can. Physical therapists can also educate you on proper squatting techniques, lunging techniques, or any motion that you're having trouble with. They can help accommodate so you can work around it or fix your technique so you can be pain-free. And if appropriate, a running analysis can be performed to make sure your running technique is on point and not causing any issues in your knees, backs, or hips. Keep in mind that movement can replace many drugs, but no drugs can ever replace a movement. Motion is lotion. Make sure that you move frequently throughout the day and your full range of motion to keep your joints and bones as healthy as possible. Thanks for listening, and let me know if you have any questions.
Hi, my name's Marlena Harrington, and I'm the owner of Personalized Fitness for You. We are a studio that has a wide variety of clients, everyone from your high school athlete to a marathon runner, first-time climber, to those that are maybe retired from their career, but not their active lifestyle. And with all of those clients, we find a common thread, as Dan has just talked about. It's all very important to have healthy bone and joints. So I could show you a few exercises that as a trainer we do here at Personalized Fitness for You without you even really realizing it. Okay, so I'm going to show you a few exercises that you at home can do to start increasing that bone and joint health that we've been talking about that's so important. And the first one that I'm going to show you is just a standard squat. Now, you could do this at home. I would suggest the best way to do it would be with the chair. There you go. For your chair height would be something lower, or you could start with something a little bit higher, maybe like a bar stool. And this would depend on what you specifically may need, depending on your strength and ability. So I'm going to start at the dining chair height. You want to have your feet about shoulder width apart, nice parallel to the chair, core engaged. And then you're going to go ahead and sit back, but not quite all the way down and relaxed, right? You're just right there touching. You're feeling all of that weight back in your heels, trying to keep your chest and shoulders back as much as possible. and then coming back up to standing. So there you have it. And then same thing right here, just at a taller height. And then as those get easier for you, there's always way to increase and to keep it challenging for you. So that there would be really good for those wanting to help their knees. So that would help strengthen the quads, which would alleviate any pain from the knees, along with the glutes. So the next exercise I'm going to show you is a push-up. All right, same type of thing where you can modify any exercise, right? So the push-ups would be great for that, for your arms, for that bone and joint health in your arms. You want to start at the taller, wrists in line with those shoulders. Legs are back, core and back is tight, and then elbows go out to the side, chest comes down, head in line with the spine, and then push back up. Okay, and then just to a lower surface. And if those are easy, you can always go to the floor. Whether you want to take it to your knees first, try it here, or standard push-up. All right, and then the third exercise I'm going to show you would be to help with your legs, with the bone and joint health in your legs. And again, modifying it to what you might need. You could just start with a march in place, to then high knees, taking it as fast as you'd like, to you could be jump roping, or walking up and down your stairs at home. Now this is 3 exercises I just showed you for your knees, legs, and arms, all for great bone and joint health. If you had any questions or wanted to further any of these exercises, be sure to give us a call at Personalized Fitness. Thanks and have a great day.